the kid finds comfort zone with you and starts sharing the entire daily course. What मम्मी पापा का झगड़ा हो गया, ये हो गया, वो हो गया.
Do that?
Yeah, they have lot of stories. Pediatric dentist is not just doing dental treatment on your kid. It is psychologically treating your kid so that the anxiety and the fear related to the dental treatment is completely eliminated. More the toothpaste is organic and SLS free, the more it gives you the feeling that you have brushed your teeth. This is what I feel.
Okay.
The thing I hated the most was endodontics.
Why?
Because it used to take a lot of chair time.
So that's the only reason?
Yeah, that is the only reason. I confidently pick up the kit and I was like, no, ye mera kit hai, I'm taking this. Then only I'm leaving, otherwise not. And I remember one of our batchmates shouting from पीछे से, Nithi, leave it, उसमें guard hai, it's not yours. I remember that guy asking me, "Pakka kit tumhara hai?"
Hi everyone, welcome to the Math Therapy Sessions podcast. Today's guest is Dr. Nithi Rajayaksha. Dr. Nithi has done her masters in pediatric dentistry and is a consultant pediodontist in Mumbai. She's a freelance photographer, avid trekker, and a sportswoman. So Nithi, I'm checking out your Instagram and you're posting a lot of photos about different shoots. So can you tell me something more about it?
Basically, I like photography a lot.
Okay.
I'm not a professional photographer, to be very honest. But because it's a hobby, I would love to be dragged. I like to pursue it and I like to be dragged towards it.
Okay.
So right now, currently, I'm working with one of the beauty pageant platform, named as the International Glamour Project.
Okay. Wow, that's wonderful.
I work with them as a behind the scene photographer, and I get to meet a lot of professional photographers in the entire shooting time. That helps me to learn a lot about photography, and at the same time, I get to do my own clicks. So it's basically learning and earning both together.
So how did you get into it? I mean, because you are a pediatric dentist.
Yeah.
So how did all this happen?
Love for photography actually started from traveling. It's all in a
Interconnected.
different, it's all interconnected.
Okay.
It all started because of traveling. I remember I had done my first trek in 2016, which was Sarpas, Himachal Pradesh.
So your first ever trek?
Yeah, first ever trek.
Okay.
But actually I was tricked into it. My friend just told me, let's go. We'll be seeing all snowy mountains. It will be a wonderful trek. I just said yes for it. And then I remember it was walking towards hell. Because the path to the entire Sarpas trek was really bad, as in it was very steep.
Okay.
I was panting a lot during the entire journey. My legs were swollen. It was that bad. But obviously there were a lot of other trekkers who encouraged me to tell me not to give up on the way. And the view, what we get from the top, is going to be mesmerizing. So, you have to continue walking. You cannot stop. So somehow I was able to pull up myself till that point. And when I saw the first view reaching up the mountain, it actually took my breath away. It was like, wow. It's okay.
It was all worth it.
Yes, it is worth it. And that's how it's applicable in our day-to-day life also. You go through so much to achieve that super fantastic view at the top. So I started correlating traveling and trekking with life scenarios. And obviously after looking at that scene...
It teaches you about life a lot.
And after looking at that scene, I felt like capturing it. And that's how my love for photography started developing.
Oh wow, so on that trip itself.
Yes, it was more of landscape photography. I jumped into that. Slowly doing the landscape photography. That time, candid photography was very new in market. The term was very new actually. Obviously the candid photography was a very old thing.
Yeah, everyone wants to do that candid.
Yeah, but the term was very new. So there were a lot of fake candids, a lot of this, that. Back to back, I had my friend's wedding to be attended. So I thought of, chalo, I'll click for you. It was like that.
And she agreed for that?
Yeah, I didn't take any money on anything. I just said, ki chalo, I'll capture your happy moments.
Okay.
So that I will learn something, I will be able to pursue my hobby, and you will get good memories out of it.
Yeah.
And by the end of 2-3 events, I realized that I am not that bad with photography and I can pursue it more. So that's how. And now I'm attached to a lot of professional photographers.
Okay.
I don't work with them full time, but somewhere or the other, whenever
Like
I have free
freelancing.
time, whenever I have free time, I call them up because of the platform which helps me out to be connected to them.
Okay.
So I get connected to them, and that's how I practice it. So I
currently
learn.
So currently you're sticking only as a behind the scenes, like a BTS.
Yeah, like a behind the scene, like a BTS photographer.
Okay. And do you want to go further in that?
I'm still learning. I would say I'm way immature than the photographer out there in the market. So I'm way immature than them. But I like it's just hobby. I don't want to excel in that. But whatever I'm doing, I just want to keep it consistent.
Okay. And do you have a page?
Yeah, I have a page on Instagram,
Okay.
which the details would be there in the link.
I'll
so,
link it in the description
Yeah,
below.
so you could just go around on Instagram and check it out.
Okay. So basically, I mean, it's all interconnected. Like photography and traveling started at the same time. And after that, have you been to more treks?
Yeah, I've been to more treks. I love going to Himachal treks. So I've been to Hamta Pass.
Okay.
That's also in Himachal Pradesh. Then I've been to Brigu Lake. That's also in Himachal Pradesh. Then I've been to Kedarkanta trek,
Okay,
which
wow.
is in Uttarakhand, which was my latest trek. And I've been just learning because of my trekking experiences.
You should also try the Triune trek. It's near.
Yeah, I've tried the Triune trek also.
You have done that?
Yeah, I've done that. So it was just a one-day trek. So for me, it was like if you're doing Himachal treks, which are around 5 to 6 days, Triune trek is just like going to a local one and coming down.
Yeah. No,
Yeah, but it's beautiful.
It's a beautiful.
It's a beautiful trek. It shows that you just have to walk up one mountain, but you have to cover 3 mountains to reach that view. So it's very beautiful.
Okay. And coming back to your main profession, which is you are a pediatric dentist.
Yeah.
So how did you become one? Why did you choose pediatric dentistry?
If you ask people around who know me, I am very fond of kids. Never thought of pursuing pediatric dentistry as a profession. It didn't even cross my mind. To be honest, after completing BDS, it was I was lost. I could see my batchmates doing internship under renowned dentists around the town during their internship itself. And if you ask me what I was doing during internship, it was completely cultural activities, doing something or the other for the college. So never thought that I really would want to pursue even BDS after dentistry after completing my BDS. But then obviously when you see people around getting serious about their career, then there are 9 fields of masters you need to do in dentistry. I shortlisted on 2. It was either orthodontics or pedodontist because both are super specialized.
Yeah.
And not very keen on oral surgery and all because I don't like too much of blood around me. So yeah, so that was the thing.
So then why did you choose pediatrics
And
or orthodontics?
yeah, because pediatric dentistry is something which would keep me more close to the kids, and I love handling kids. It's not just so you will be shocked to know that I went to my nanny for the advice. She doesn't even know that there are
Your grandmother.
Yeah, my grandmother. So she doesn't even have an idea that pediatric dentistry has
There's
9
something
fields
like
apart from normal BDS. So she was like, क्या करने का है? Just dentistry करो और सबका दांत ठीक करो.
बराबर.
Then I told her कि ऐसा field में I have shortlisted. Please guide me. Then she told me, what is pediatric dentistry? I said, it's related with kids. It's only treating kids and all this. She's like, you love doing kids ka treatment. You love talking to kids. Why don't you just pursue it? So I was like, okay, let's do it. And then once I got into pediatric dentistry, the first year made me fall in love with that subject. Second year, I was more in love. And now I can't think beyond pediatric dentistry.
So what's the best thing about being a pediatric dentist?
The best thing is the compliments what you get from your patients.
Okay, the kids themselves or the parents?
The kids.
Okay.
Parents is okay. Everybody's going to appreciate you at the end of the day.
Okay.
But the compliments which come from the kids, compliments show even a gesture what they do for you, or even a chota sentence, whatever they say to you, it comes from dil se. So whatever comes, it comes within them. So it's like it's a true compliment.
Yeah.
It cannot be it's not something manipulated. It is genuinely coming from their heart.
Pure.
It's pure. So it's wonderful. There are a lot of times where kids don't even appreciate because they are strictly instructed by their parents, you have to go, get your treatment done and come out.
Yeah.
But during that entire process of the treatment, when the kid finds comfort zone with you and starts sharing the entire daily course, what
Yeah.
मम्मी पापा का झगड़ा हो गया, ये हो गया, वो हो
they
गया.
do that?
Yeah, they have lot of stories. There are a lot of personal discussions which happen on the table,
Yeah.
on the chair actually.
Yeah.
When I'm talking to the kid, I just start off with one topic and then they end the topic. There is no goodbye. There is just talking.
And what's one thing which you dislike about pediatric dentistry, or something which you would want to change?
I want to change, or maybe I won't say that I dislike, but obviously because there is a lack of awareness in pediatric dentistry amongst parents, so it's very difficult to convince the parents the need of the treatment. So I would say it's easy to handle a kid, but it's very difficult to handle a parent.
Okay.
So
You mean they don't easily agree to the treatment or something
it's
like
not
that?
about easily agreeing. So see, if you ask me how I work on my patients, it's like when a patient walks in, I never talk to the parent directly. It's always I talk to the patient first.
Okay.
A lot of parents find this very rude. A lot of parents say that ki paise to hum bharne wale hai, you should talk to us first. But that's not the case. Pediatric dentist is not just doing dental treatment on your kid. It is psychologically treating your kid so that the anxiety and the fear related to the dental treatment is completely eliminated.
Okay.
Because younger the age group, more fears and anxiety can be developed, which can be in the child for lifelong.
Okay.
So you need to. So as a pediatric dentist, when I try to implement that on a patient, sometimes the parents fail to understand this.
Yeah.
So I feel somewhere or the other, it's just because of lack of awareness about the field, about the need of the treatment, that the parents don't cooperate so much with us.
So what can we do to make it better? I mean, have you ever given it a thought
Yeah, I mean, I think one-on-one conversation with, obviously first consultation with the patient, with the kid, and the second consultation, spend at least half an hour with the parent to make them understand how we're going to go about with the treatment with the kid. So, once you take the kid in the confidence, obviously, if the kid is liking you, the kid is not going to go anywhere else.
Yeah.
But the parent also needs to know that whoever the kid is getting treated by, that person can be genuinely trusted.
Yeah.
So, it takes a lot of chair time, no doubt, but I think that is required to gain parents' trust. That is there.
And do you see any difference happening? I mean, for example, if there's a father or a mother who was earlier apprehensive about getting a treatment done, and now after repeated consultations, they you go from negative to positive.
There are actually a lot of cases such that. So a lot of times, we try to convince the parent for a treatment. They don't agree at first, but then later they agree. And after few days, they come up to us saying, we have one more friend whose kid is going to the same trouble.
Okay.
And the parent is still not agreeing. जैसे आपने मुझे convince किया, क्या आप उसको कर सकते हो क्या?
Yeah.
So it's like, then I tell them it's not about convincing. I have not convinced you. I have just showed you the problem. You have realized what is the problem.
Yeah.
And your self-realization have made you get your kid to the chair.
Yeah.
So that is more important. So sometimes we say references which people give. See, if suppose you are referring a pediatric patient to me, so that patient might have a good experience about me.
Okay.
The kid might really love me. But not necessarily if that same parent is referring it to somebody else, that person will also like me. So it's all about self-realization. Unless and until the parent realizes the root cause and they really want to get it treated, वो नहीं होने वाला है. How much ever I try to convince. And it's with everyone. I feel if you're not convinced itself, or if you don't realize it, you're not able to accept it.
Understood.
Yeah.
So ideally, when a couple has their first kid, or any kid, so what should be the ideal age as to when should they visit the dentist for the kid's first dental checkup or anything of that sort?
So obviously awareness should begin as soon as the mother knows that she's pregnant. Okay? The awareness should begin from there only. In this awareness, gynecologist, a pediatrician plays a very important role. along with a pediatric dentist.
Okay.
So because the first and the former doctor which a pregnant woman sees is a gynecologist. Then the second doctor which she would want in her list is a pediatrician for her kid.
Yeah.
She'll directly not go to a pediatric dentist. So these two doctors play a very important role to create awareness among the pregnant ladies about oral hygiene and oral health maintenance. Once the kid is born, it's come into the life, the mother needs to maintain the oral hygiene as soon as the kid is born. Right from cleaning the gums. Bale, there is no teeth, but cleaning of gums, cleaning of tongue should be
How do
maintained.
they do that then?
So you can ask the mother to use a muslin cloth which she can wrap around her finger, and she can just run the finger around the gums and the tongue.
Okay.
That can be done. There are newer, very soft toothbrushes also available in the market, which are very small size, which are U-shaped, which the mother can put it up in the kid's mouth and she can just rotate it. You don't need to use a toothpaste. There are very soft bristle toothbrushes which are available in the market.
So how long should they do this? Like
While you're bathing the kid, or maybe while you're massaging the kid during that time, at least once a day. Once the teeth is erupted, as soon as your first teeth erupts,
the first teeth comes out.
yeah,
Okay.
first teeth erupt, that is the time you need to start brushing the teeth properly. Because obviously whatever milk remnants are remaining in the gums and around, they'll start sticking to the teeth, because tooth is a hard structure as compared to the gums. So they'll start sticking to the tooth. So the duration of cleaning of the gums and the teeth needs to be increased. It has to be twice a day, not once a day. So that's how you need to be. And obviously, as soon as your first teeth erupts, the first dental checkup should be done. Irrespective of whether the kid has cavities or doesn't have cavity, or if there is anything concerned, nothing concerned, still get a consultation done.
Okay.
Because it's always better to be preventive, than to be in corrective phase. It's always better like that.
And any suggestion you would want to give to parents as to what kind of toothbrush and toothpaste they should buy for their kids?
It's a very vague. It's a very vague question, but because it absolutely depends upon the age of the child.
See, I think once you have the patient on the chair, you analyze the dentition, then you can give a proper detailed answer. But then just vaguely.
Yeah, I would just advise ki as soon as you feel that your kid there is a black hole in the kid's mouth, or there is any kind of cavity which you see, don't experiment just by looking into Google search, or just teeth वापस rebuilt होगा क्या, ये होगा क्या. Don't do that. I would always advise them, get a consultation done.
Okay.
Just get a consultation done. So because whatever age group your kid is falling up into, according to that, the dentist would advise you what is needed and what is not needed. So there are a lot of different brand toothbrushes and toothpaste in the market. I would just advise go for organic ones and the one which are foam free for kids, because
SLS free.
Yeah, SLS free. So that would be the best.
Any particular reason why you want it to be organic?
I don't know. I would just say ki more the toothpaste is organic and SLS free, the more it gives you the feeling that you have brushed your teeth. This is what I feel.
Okay.
Okay. If I would ask me as an adult, even if when we are
do you follow that yourself? Like
yeah.
Okay.
So if I'm using I would not name any brand, but if I'm using a normal regular toothpaste and it has too much of it has SLS, it has too much of foaming agent in it. I hardly tend to brush even for entire 1 minute, because too much of foam causes gag. So you tend to spit out the toothpaste more rather than brushing your teeth for a longer time. So
makes sense, yeah.
Yeah. So I feel that this is my experience. And everybody will have their own different experience. So I feel, if the kid cannot keep the toothpaste and the toothbrush in mouth even for a minute, what they would brush? They will not brush. Hardly the brush is going to reach at any tooth. So it would be better if it's organic and SLS free.
That's great advice, actually. Coming back to your BDS days, what was your favorite BDS posting and why?
Very ironically, my favorite BDS posting was oral surgery.
Okay.
Because the only thing we had to do was extractions.
Yeah.
And post extractions, we had a set number of extractions to be done in a day. So once that is done, then you're free to do whatever else you would want to do. So we could just roam around in the entire college like bosses. So yeah, obviously it was most, and the worst, or not worst, I mean the posting I hated the most was endodontics.
Why?
Because
Why is
it used to take a lot of chair time. Used to-
so that's the only reason.
yeah, that is the only reason. Because college meant to be fun, yeah. I know we did a lot of a lot of studies, a lot of struggle till 4th year.
The first 4 years.
First 4 years. So internship, we wanted to have, like, we wanted our time.
I completely agree with you.
Yeah.
Because I was a part of it.
Yeah. And we were too active with cultural activities and everything.
Yeah.
So I think we would wanted to be more outside the college than being in college. So oral surgery used to be my best posting.
Okay. Any memorable experiences you would want to share? I mean, during your college days, it can be BDS, MDS, anything, but just anything you want to share.
I would just share a recent experience which I just, I would not say it's anything related to college, but recently I visited the institute back just to meet my teachers and all.
Mm-hmm.
I was waiting for my staff to get free because they were in a meeting.
Mm-hmm.
Suddenly a lady walks into me. She's like, "Aap Dr. Nithi ho kya?" And I was like, I was just wondering, I'm not so famous, so why is she asking? So I was like,
No, of course you're famous, yeah.
No, then I was like, yeah, tell me. So she's like, आपने अफरा, her daughter, आपने अफरा का ट्रीटमेंट किया था 4 साल पहले. I was like, honestly, I don't remember her daughter unless and until she showed me the picture. And obviously in mass तो पहचान में भी नहीं आया that the parent is that same kid का parent.
बराबर.
But then she started talking and all, and then few things she told me, I really felt so proud of me at that particular moment, that she's telling me, Afra, आपकी रोज याद निकालती है. She always admires. For her, doctor is equal to Dr. Nithi. So the compliment what she gave me, or the experience what she shared me,
It was completely out of the blue. Like,
out of the blue. I didn't expect that, because it's not for the first time that I went to the institute. I've been going there a lot of time post my MDS to meet my teachers and all, but this was something very unexpected. And the way she was telling me about her daughter growing up, when I treated her, she was 4-year-old. Now she was 8.
yeah.
So completely changed, and still she remembers me. It's 4 years down the line and she still remembers me. Her younger brother's treatment was going on with some other currently working a PG, postgraduate. She's telling me, we were actually looking for you. We wanted to get it treated by you. And the entire experience what she shared was really heart touching. So I really felt overwhelmed around it. So then I was like, then she exchanged numbers and she's like, I'll make sure that we do a video call. Because Afra wants to meet me in person. So that was nice.
That's sweet.
That was really a nice gesture, which I really felt was good.
Any other fun experience you want to share?
A lot. If
Anyone.
Fun experience, you were a part of that fun experience, if you remember.
Which one?
Particularly when we used to practice for our cricket DPL, that is our Dental Premier Leagues. We had a very nice experience. One of the practice experience we had, where we were actually practicing cricket on somebody else's property.
Sanpada,
yeah. And Sanpada in somebody else's property. And few guys came down and they were like, kya chal raha hai, and all that. I cannot forget that.
We were not trespassing, yeah?
We were not trespassing because the gate clearly mentioned that outsiders can play over the ground. But those were local goons. I would just say that. I remember how confidently we all were standing, and I was the only girl amongst you guys that took, because they were all ready to take our kits and everything and were ready to, like, you can go, but the kits has to be remained here.
Yeah, they were ready.
And I confidently pick up the kit and I was like, no, ye mera kit hai, I'm taking this. Then only I'm leaving, otherwise not leaving. And I remember one of our batchmates shouting from पीछे से, Nithi, leave it, उसमें guard hai, it's not yours. I remember that guy asking me, पक्का kit तुम्हारा है? I was like, yes. Because it was completely लड़कों का kit था. It had all cricket guards and everything, and I was so confident about ये kit मेरा है. I can never forget that day. But it was fun.
Fun times, yeah.
Yeah, fun times.
So, speaking about cricket, you're also an avid athlete yourself. You play multiple sports. So, something about that, please.
Many people don't know this, but
Because
I used to play lawn tennis back in my school days.
Okay, wow.
I used to be an MSLTA ranker
Wow.
in the first 10. So
Never knew that, yeah.
Yeah, actually, but I pursued lawn tennis right from 5th standard to 9th standard, and I'm proud to say that I was in the first 10 rankers. I remember a lot of memories with respect to that. I remember me and my mom, we used to just take my tennis kit. I've almost covered the entire Maharashtra for lawn tennis matches. So it used to be really fun. Obviously, because of some medical issues, I couldn't continue with that.
Okay.
I had to give it a drop. And obviously, being Indian parents, then 10वीं aa gaya, 12वीं aa gaya, you need to
Pursue
focus
it
on
further,
your, you need to focus on your career first and then sports. So yeah, that's how. I had a strong interest in cricket. Even during when I used to play lawn tennis, my coach used to get very irritated on me because when we used to have a warm-up session before the lawn tennis practice, we had a 15 minutes break. In that 15 minutes break, we used to play cricket. And cricket changes your grip towards lawn tennis, holding racket.
So that's how you used to hit those sixes.
Yeah, a lot. My coach used to almost get like goosebumps, ki bahar mat maar dena. You have to play within the court, not outside the court.
It's ulta.
And then, honestly, lawn tennis was never my first love. It was my dad's dream that I should play lawn tennis. Slowly, because cricket pulled me close to it. So I was very stubborn ki either it's cricket or it's nothing. So then dad is like, forget it. Let's not continue with that. Then I tried getting into, I had got a lot of opportunities playing cricket. I would not say that I didn't get any, but I think I didn't make good use of those opportunities.
Okay.
So otherwise, I think I could have been able to see me somewhere in the cricket team, but a lot of lost opportunities actually. I had actually lot of opportunities, but I lost them. I would say I just lost it on my own hands.
But then during your BDS days and even after that, I think in the last 10 years of
I've been actively playing cricket. I don't know how well you are aware of this fact, but there are a lot of open tournaments which happen over the weekends in Bombay. Women tournaments, open category.
It's only for doctors or it's for everyone?
No, it's for everybody.
Okay.
It's for everybody.
Okay.
The best part about those open tournaments is obviously you get to meet a lot of other people from different fields.
Yeah.
And if you think I am a good cricketer, you have not seen the half of Bombay. Dude, they play amazing. They play amazing. And there are ladies who are 40 plus and who are too good and dedicatedly come on every weekends to play cricket. ऐसा लगता ही नहीं that they have a family to take care of.
Yeah.
They are so supported by their family.
That's inspirational.
Yeah, that's very nice. A lot of ladies and it's too good. The organizing part, the playing, everything. It's so good to be on field on those two days, like Saturday, Sunday. You forget everything. You don't need to remember that you're a dentist playing on the field. You're just a cricketer on the field.
Yeah.
So that's the best thing about a sport. When you're on the field, you forget what you are and you just dedicate yourself to the game. That is the best thing.
My personal favorite question was, what's your favorite oral healthcare brand?
I don't have any favorites as such, but nowadays, nowadays I'm very I keenly follow Mamaearth.
Mamaearth.
Yeah, I keenly follow Mamaearth because I've been seeing their products. They're very nice, very non-toxic. That's the best thing. Made in India. So I really follow those products, and I have been advising my patients to use the toothpaste of that brand, the younger age group, that is less than 6 years of age. So I've been seeing that, and the results are quite good. So I would recommend that brand. I would really recommend that brand.
And it works for you. So
it works for me. And if you look into their other products as well, that is also it's a complete mother and child care product.
Okay.
So they have quite concentrated on the age group, on the mothers. So I really like those brands.
So you are a athlete, you are into photography, you are into traveling, you are a full-time pediatric dentist. What do you think, how important is the support of your family been in this journey of yours?
A lot. Obviously, you cannot do anything without support of your family, because you need to space out your time.
Yeah.
It's like in the morning and the evening, we are busy with the appointments. In between, when you get time, you pursue your hobbies, you go for so need to manage everything, and obviously need to inform the family pre-hand a little bit, because otherwise the family has a good statement to say, you're not a paying guest here. You cannot walk in anytime and every
Walk
time.
out, yeah.
There are certain disciplines of the house which you need to follow.
Yeah.
And yeah, baki everything falls in place.
Yeah.
You just need to follow certain rules and then everything falls
I
in
asked you
place.
because you are into so many different things. So of course you can't do that without
Actually, lockdown made me realize that, there is nothing which cannot be done. You need to take out time to do things. So if you take out time, you will be able to do whatever you have planned in your life. It is just about taking out time. And there are a lot of time in the entire day. There's 24 hours here.
Yeah.
8 hours only we sleep.
Yeah.
The rest of the time we have time.
You sleep 8 hours?
Sometimes 9 or 10.
I hardly get 6, yeah.
I would not lie. Sometimes 9 or 10. Lockdown to pucho mat.
Okay, whatever floats your boat and makes you happy. So then, coming to our last question, what's next for Dr. Nithi?
Something really interesting.
Okay.
In lockdown, post lockdown, when I started working back with my patients, I realized that 1.5 years of lockdown have had a tremendous effect on child psychology. Okay, like the children who used to talk a lot suddenly became very introvert. So the children who used to be introvert suddenly became very extrovert. They wanted to meet new people. So a lot of reverse.
That's me.
Yeah, a lot of psychological changes in growing children. Lot. Like if you ask me, there is a kid at my house, my nephew. He himself changed a lot during the lockdown. Before lockdown, he used to not like talking to any one of us. Only him and his mom. During the lockdown, regular basis we started video calling each other because he didn't want it to be alone at home.
Yeah.
So he wanted somebody to talk to apart from his own parents. So that's how he started to become very extrovert. He started talking. But a lot of difference and a lot of impact on the psychology. And I love reading psychology and children's mindset. So, when a kid walks in the dental clinic, I don't look directly into the mouth. I'll talk to the kid, trying to understand the child psychology. So this topic, child psychology, is very interesting, and I want to learn more about it. So the next thing what I'm going to do is I'm going to pursue child psychology, and I just want to learn more in detail. There is something which is.
But how do you do that? Like, is there a course?
Yeah, there is a course. There's a course which is a yearly course, which would allow me to help and counsel the children who have psychological issues, and it comes along with parental guidance. So not only counseling the child would help, but even guiding the parents related to same issue related to their child would help them. So along with, because a lot of times we give a free advice. It's not accepted by the parents because we are dentists.
Yeah.
Why, if you're a dentist, just talk about dental. Don't talk about anything else.
They think you have
Yes.
malicious intents
Yes.
behind it.
So if you have that credentials after your name, which says that you are a child counselor and a psychologist as well, it would give me a hold to tell the parent in a much better way. So that's new for me. That's gonna come up soon.
That's one. And anything else? I'm sure there are many more things to go, but professionally,
For now, only this much.
something on your photography front, something on
That though will happen if I'm looking for few opportunities. There are some things which are lined up. Wouldn't want to talk about them because let them happen, then we'll discuss about it.
Okay. And traveling wise, what's your next trek? Like, I'm sure you have a dream list, like, which all treks
I
you
have.
want to go.
So the next one which I'm heading to, it's not a trek actually, it's a solo trip.
Okay.
Planning for Rajasthan.
Rajasthan.
Yeah.
Okay. Entire Rajasthan, something like that, or
Maybe just Udaipur, Jaisalmer and Jaipur. 3 of them.
okay.
Yeah. But that's there on the list.
Awesome. Thank you, Dr. Nidhi, for taking out time for this
Thank you so much,
podcast.
Arif. Thank
It was
you.
great having you, and we'll see you again soon. Thank you.
Thank you. How was it?
It was good.
पसीना आ रहा है को इतना और तू बोल रहा था ठंडी लगेगा. A lot of editing, I think.
No editing.
Dude, we talk फटती है. तू कितना हंसता है?
Focus.
I don't know. I think I was nervous.
It's fine.
बॉस अच्छी क्लिप्स ही लेना. बाकी कट कर